Pre-COVID, Palestine is at the mercy of the long-standing occupation and blockade and the impact on their health infrastructure and socioeconomic conditions and social determinants of health. So people have a wide range of healthcare needs that are unmet. MSF has focused as an emergency humanitarian organisation in Gaza, firstly on trauma care. We do surgical, microbiological, antibiotic stewardship, holistic approach to osteomyelitis and post-trauma care for patients who are affected by conflict-related violence. We also have an ambulatory care OPD service with a patient-centred approach where we have a number of different outpatient components, so orthopaedic follow-up. We have antibiotic follow-up, physiotherapy, occupational therapy, psychosocial support, chronic pain management, and we have a social worker therapeutic patient education service to try to guide these vulnerable individuals who have been injured in the conflict through the services that we're offering. We also have a relationship with MSF's flagship RSP project in Amman doing reconstructive surgery, and we refer patients from our Gaza cohort who have injuries that are too complex for us to manage in Gaza to the Amman service. We also look after, and actually the much bigger proportion of our work now that the Great March of Return has ceased is looking after burn patients in Gaza. So MSF provides the only outpatient and post-operative care service for burn patients in Gaza. And we see about 5,000 patients a year through our OPD service. And we also support the Ministry of Health with operating theatre and inpatient department at Shifa Hospital for acute and subacute burns. Most of the burn population that we see are domestic burns, so it's not conflict related. 60% of those are caused by hot liquids, so knocking over kettles and pots. And as you might imagine, a very high proportion of those are young children. So we will see someone at the beginning of their life who has a life-changing injury, and if they don't get the right acute care for that burn and really meticulous post-operative management, they can have an injury that will impact their entire life and their ability to work and to lead a normal functional existence. So it's a really complex burden of disease, and burns are quite neglected generally. So MSF is really committed to supporting the Ministry of Health in developing their burn service over the next few years. We also have psychosocial support and chronic pain management. So we have a pain specialist, Palestinian pain specialist, who has developed a really innovative program integrated with psychological support using virtual reality masks, nerve blocks, all sorts of different non-opioid pain modes to try to address the issues faced by this population with chronic pain, which is quite debilitating. We have a 23-bed trauma unit at Nasser Hospital, where the Ministry of Health also run their limb reconstructive service, and we work in close collaboration there at Nasser with the MOH surgical team. We, at the moment, are managing to operate about 20 cases per month, and the operations are quite complex, and the inpatient department admission is quite complex for osteomyelitis, which is the majority of our patients. Patients need to have a surgical debridement. We analyse the samples in our microbiology lab, and then we identify which antibiotic is the right one for the bacteria that we have found, and then that person goes on to up to 6 weeks of antibiotics to really try to get the infection in the bone under control before we would think about reconstructive surgery. So these are long admissions often in the inpatient department. Even if it's not an admission, we're looking after that patient in the community, making sure they don't stop taking their antibiotics, which can be quite dangerous. It's a really complex, cohesive service that we're offering, and I think it's really trying to address all aspects of what's happening to these patients who have sustained conflict-related injuries during the Great March of Return.